What guidance can you give to parents and caregivers to reduce dental disease and promote good oral health? First, advise on how to minimize the risk of infection. Family members should not clean pacifiers with their mouth or share cups, bottles, eating utensils, and toothbrushes. Next, inform parents about good oral hygiene for themselves and their child. Clean the infant's gums with a wet cloth after each feeding. Brush twice a day, and replace the toothbrush when the bristles fray. Primary care providers may wish to recommend xylitol chewing gum 3 to 5 times per day for caregivers of high-risk children, as studies have shown reduced oral bacteria levels in the children of parents who use xylitol gum. And finally, provide guidance on reducing how often and how much sugar is in the child's diet. First, don't put a baby to bed with a bottle unless it contains only water. Second, continuous drinking from a bottle or sippy cup filled with milk, formula, juice, or soda pop may lead to early childhood decay. Third, a pacifier should always be cleaned and not dipped in sugary substances. Fourth, avoid frequent sugar-containing snacks. Finally, use a combination of fluorides to strengthen and protect teeth from decay. Counsel parents to clean or brush their young child's teeth twice daily. The parent should apply the toothpaste a pea-sized amount beginning at age 2. The parent should be encouraged to perform and supervise their child's toothbrushing until the child has the motor skills and judgment to do it alone. There are a number of excellent resource materials available for primary care providers, some of which are included in the Smiles for Ohio manual. Many can be downloaded from the Ohio Department of Health's website, as well as the sites of medical, dental, and public health organizations. A list can be found in the manual. Referring a child who needs dental treatment is an important component of Ohio's fluoride varnish program. The American Academy of Pediatrics recommends establishing a dental home by age 1 for children who are at increased risk. The American Academy of Pediatric Dentistry and the American Dental Association agree. While that may be the party line, it's no party in Ohio. As mentioned earlier in this presentation, only 3% of very young children on Medicaid received any dental services through the Early and Periodic Screening, Diagnosis, and Treatment Program. A survey conducted by Siegel and others in Ohio determined that only 8% of the general dentists in the state recommended a first dental visit by 1 year of age, and only 1/3 saw a child under age 3. The best bet is to refer a child to a pediatric dentist in your community. However, there are only about 140 pediatric dentists in the state, not enough to meet the need, particularly in rural areas. Another option is to contact children's hospitals and dental schools. Again, these are few in number, and children's hospital dental clinics are often overextended. Some hospitals have general practice residencies or programs for advanced education in general dentistry, which provide another option. Learn whether other safety net dental clinics exist in your area. The Ohio Department of Health's website provides a list. There are general dentists out there willing to see young patients, and word of mouth is sometimes the best way to identify these providers. Finally, if there's a case management program for children with Medicaid coverage in your area, contact them for a referral list. Now let's